Hello there, my name is Renee, and this is a short presentation on how you can incorporate retrieval skills into your classroom. The techniques I'm going to show you can easily be adapted to nearly any classroom setting. For this one, I will focus on the Health Information Management Program, or HIM as I'll refer to it from here on out. Have you ever wondered if there's just that one extra thing that you could do to help your students recall the information you've taught, or if there was a way that you could adjust your teaching style to help them recall information from a particular part of your class for the midterm or even for the final exam? Well, if you have, this presentation is something that you may want to consider incorporating into your class. Research studies have been conducted over the past 10 years that show that there is something we can do to help our students with recalling learned material. Let's look at the learning objectives and then I will explain. By the end of this presentation, you will be able to explain how learning occurs, determine how to incorporate at least one of the retrieval practices into your classroom, as well as describe the 3 steps of the retrieval process. I thought this picture was a funny depiction of how we may sometimes feel or think about students learning. If it were only as easy as putting a book in a machine to feed out to our students all at one time, but we know it definitely is not that easy. So let's talk about how we learn, the study habits of a typical student, and different types of practice that you can do to help your students build a deeper connection to the material they are learning. The first part of learning is encoding. If you think of all the things that you're exposed to in a day's time, it's voluminous. All of our perceptions, the sights, the sounds, the smells, are converted to meaningful representations within our brain. In a way, you can think of it as bits of information placed on a bunch of sticky notes in your brain, or what we actually will call our short-term memory. Knowing that our brain can only hold so much in its short-term memory, some things will be lost if not consolidated into our long-term memory. Consolidation actually happens when we take information that we have encoded and we strengthen it, thus moving it to our long-term memory. For example, let's say you have something that you don't want to forget. In our mind, we are thinking of ways to remember it. During this process, our mind is reorganizing the information and creating that stronger memory path to recall at a later time. The last part of learning is the retrieval process, being able to locate that information we have previously consolidated. One way to do this is through retrieval cues. Retrieval cues help us find the information we have stored and brings it out when we need it. In order to keep our retrieval cues strong, we must periodically refresh them, or we could lose them altogether. Now that we know how our brains build a deep connection for recall, let's talk about how our students study and see if it is effective. Many students have been taught to study, study, study if they want to learn something. Rereading all of the information that has been covered is a typical study habit for many students. I have had some students tell me they have spent hours studying this way. Another common study habit is highlighting. I know we've all been there at some point in time in our lives where it seemed like we highlighted the entire book. While highlighting the key points is what we should do, students tend to highlight everything. Although highlighting may give the student a feeling of knowing the material, once it is all highlighted and the student goes to study, it now looks like it all needs to be studied again. The last typical study habit is cramming. Students often restudy all of the information that they can in order to remember it for the next day's test. Yes, again, we've probably all been there, but how did it work for us? We probably remember just enough to pass the test that next day, but did we remember enough for the final exam? Probably not. In the next few slides, I want to show you how we as educators can teach in a way that will help our students be able to eliminate some of these typical study habits and create new ones that they will come to use as a result of the way we are teaching. When it comes to teaching, we typically teach one topic or maybe just one chapter of a particular subject before moving on to the next. We do this until everyone in the class, quote-unquote, has it per se. This type of mass practice is easy, and it gives the students and the teacher a sense of accomplishment or understanding of that topic. But what happens in 3 weeks when the students are tested on the information they knew in class? This type of learning is not easily recalled, and therefore the students resort to the typical study habits I mentioned before. Although some mass practice is good, if we want to build a deeper learning from what we teach, we need to mix up the types of learning practices that we use. There are 3 I want to show you: spaced practice, interleaved practice, and varied practice. Spaced practice is basically putting time between the information you teach. For those of us in HIM, if we go to an all-day coding seminar, we are expected to come back with a vast amount of knowledge. Remembering it over the next few days or weeks is not that easy. So let's say instead of going to the seminar for 1 day or 8 straight hours, we have it broke down into 4 days for 2 hours a day. Each day we go back, the coding lesson is continued. What this does is give us a need to recall the information from the previous day to continue in the current day's session and so on. This type of learning helps consolidate the information we learned the previous day by not only recalling it, but adding more to it. Forgetting is key here. It forces us to try a little harder at the retrieval, but as we do, we build a stronger memory. The second one is the interleaving practice. This is where we take multiple skill sets and interleave them together. The student must now discern which information to use in order to solve a problem. Let's take the student that's learning to code. They must learn how to apply coding guidelines to codes in the ICD-10 CM book. If we are teaching them one set of guidelines at a time, we are limiting ourselves to the types of scenarios that we use for teaching, thus limiting the student as well. If we were to teach multiple guidelines at once and focus on a particular chapter, our scenarios will allow the student to be able to determine which guideline will need to be applied to that particular scenario. The more the student switches back and forth to apply the correct guideline, the more they consolidate that material for recall later on. Since I know you are not all in HIM, another way to say this is by using the research conducted by Brown, Rodiger, and McDaniel. Their study was done on a class of students learning how to find the volume of 4 geometrical shapes. They took half of the classroom and had them study each of the 4 shapes one at a time until they knew it before moving on to the next shape, or using massed practice. The other half of the class used the method of interleaving. They took all 4 shapes and intermixed all of the problems, never knowing which one they would get. After both groups were given the same amount of time to work the same number of problems, the students are tested on what they had learned. The first half of the students that used massed practice scored very well on the test, and overall, they in fact scored 89% correct, while the second half of the class that used interleaved practice only scored 60% correct. The scores are probably what you might have thought would happen, but what do you think happened a week later when they all took the same test again? It may surprise you, but the first half of the students who solved the problems using massed practice scored only an average of 20% on the test, where those in the second group, using the interleaved method, averaged 63%. This shows that massed practice is really a form of short-term memory. In essence, these students get an immediate feeling of accomplishment after the lesson, where those students interleaving had to keep reconsolidating their thoughts, putting them into their long-term memory, which they were able to recall at a later time. The last type of practice I want to talk about is varied practice. Here a student incorporates the information they have learned from one or more subjects into a different class or situation successfully to show a mastery of their skills. Again, using the HIM student, we know that these students must take all of their anatomy and physiology, pathophysiology, drug classification courses, and more prior to coding. So with their knowledge of these subjects, they now come into our coding classes. The students must be able to apply the knowledge of multiple subjects in order to be successful at determining what codes they must assign for each scenario. They must also know that if the diagnosis provided by the physician is not a complete reflection of the encounter, using their knowledge of the subjects they've studied, they know what to query the physician in order for him or her to be able to provide more documentation of a diagnosis. This is key for a student to show mastery. For example, a student is to code an encounter of a patient that comes into the emergency room. The patient's symptoms are headache, abdominal pain, and fever. The physician does a CT scan of the head and abdomen and orders a urinalysis with a culture. The test results show the CT of the head and abdomen is normal, and the urine culture comes back positive for E. coli. The diagnosis the physician gives is migraine and sends the patient home with a prescription for Imitrex and Bactrim. All students know they can only code what is documented by the physician. So if a student codes only the migraine, they are not showing their mastery. However, a student showing mastery will not only code the migraine, but also query the physician for the other findings they have in the chart. This student knows that the symptoms of a urinary tract infection, UTI, are abdominal pain, fever, positive urine culture, and treatment includes putting the patient on Bactrim. This student knows to query the physician about these findings to see if the UTI should also be coded. These types of mistakes, once the student is out in the field coding, could negatively impact reimbursement for the facility. I believe incorporating these types of learning practices into the HIM program can greatly improve the quality of students going out into this profession, and if incorporated throughout the entire program, it could profoundly help the student that is setting for their national exam. One suggestion I have for implementing these practices into the HIM program would be in the way the coding classes are structured. Here we could incorporate the previous courses of study directly related to coding into the coding lessons to help the student reinforce that link to the information about a particular disease or process that can affect the outcomes of all codes they assign. In summary, now that you know how the brain learns, as well as the 3 steps of the retrieval process, you should be able to incorporate at least one of the retrieval practices into your classroom. Give it a try. I'm sure you will be successful. If you would like to know more about this topic or studies conducted on students, I would recommend reading the book listed here, Make It Stick: The Science of Successful Learning by Peter Brown, Henry Rodiger, and Mark McDaniel. Thank you and have a wonderful day.